morning. You're listening to Dental MD. I'm Dr. Jessica Saepoff, and I do this show in order to give just general information and sometimes specific information about all the different areas of dentistry so that you can make better choices and choices that suit you better. If you don't have information, then you cannot form the kinds of questions that will lead you to the solutions that make the most sense for you. And in this day and age, it is, the battle that's raging now is a battle for information. The censorship that's happening right now and the misinformation and disinformation that's put out apparently to deliberately mislead and confuse, and people don't know who to listen to anymore. Is it still the man or the lady in the white coat? I mean, that's certainly how it used to be, but, I think a lot of people have become really jaded and don't know where to turn and who to listen to. And it used to be that you could go online and do searches and get information that, was hard to come by. And now with all of the censorship, that's gotten a little bit less reliable as well. So where can people turn? Where can people turn to get information that lets them ask intelligent questions so that when you do give consent for a treatment, it's actually informed consent and not just, the information that's been tailored for you to get you to make a particular choice that the practitioner thinks is the best choice for you. That's getting a little old now, isn't it? I think it is. So I'm on the radio every week to just give information about dentistry and dental choices and dental treatments for all ages and all kinds of categories of treatment. And the way that I get my information, I already have more information than you do as a layperson. I have more terms that I can call on to add to my searches to get more information. And I'm already well versed in a lot of alternatives and alternative thinking and alternative organizations and people. And my searches are going to bring me really, even in this age of censorship, a lot richer results than if you don't have the information in your questions, so that the questions really bring you those results. So I do this show so that I can bring you the results of my searches, which are, fairly consistent. I am on all the time online and at courses and in discussions with people to make sure that I'm as up to date as possible on what all of your options are for almost any kind of dental situation, oral health situation, not just teeth, but gums, jaw joints, and airway. And that's what I'm going to talk about today. Today is orthodontics and airway. And of course, it's not possible to have a discussion about orthodontics and your airway without also talking about your jaw joints, the TMJ. So I did recently go to a course, and today I am bringing you the results of what I learned in that course. And this was a course on orthodontics, and I'm going to tell you some things about orthodontics, different ways that orthodontics can be done that will bring different results and different lifelong, long-term results, and apparently results to your complete overall health as well as your oral health and the health of your teeth. So a lot of people have had orthodontics done, that's teeth straightening, and whether it was done purely for cosmetic or aesthetic reasons or not, sometimes orthodontics is done in order to stabilize a bite position. It doesn't, it can create or change your bite position, but generally that's not the usual main goal. So, straightening teeth, a lot of the advertising that you see nowadays is geared toward beauty and cosmetics and aesthetics. And if you look at ads online for various systems that industry wants you as a patient to ask for when you go to the dental office, they want you to go in and ask for certain things by brand name, which I think is, you know, I don't agree with that. That's the same to me as advertising pharmaceutical products to patients and then having you go in and ask for a particular drug by name to your doctor, and that encourages your doctor to prescribe that more, and that makes the pharmaceutical company that makes that drug very happy. And that's kind of, to me, that's sort of backwards. But ultimately, it's fine for patients to know about different methods and have a preference, but the practitioner that you go to has the final say on what materials and techniques will be used. And you should be given choices that make sense for your situation. But as a patient, you don't really know your complete situation. You might look in the mirror like the ad tells you to and see that you've got a couple of teeth that are out of position and not straight, or your smile is, not as broad or prominent or whatever it is. And crowded and crooked, so to speak, teeth, that is a valid reason to do orthodontics. But if you go in and you ask for a specific type of orthodontic brand name product because you want a tooth straightened or a couple of teeth straightened straighter, because your confidence has been rattled by some commercial showing lots of perfect straight teeth, if that dentist that you go to just straightens those few teeth and does not know or care to look at the health of your jaw joints, your bite position, your overall posture, your neck posture, and your airway before locking you into an occlusion or a bite position that doesn't improve those things or worse, makes it worse, then they're really doing a disservice, even though you've come in asking for, I want these two teeth straight, and the dentist says, okay, pay this much, and we're going to use the technique you asked for that you saw on TV, and we're going to straighten those two teeth, and then you're done. And sometimes that little straightening of a couple of teeth can use up all of the insurance that you have available for orthodontic treatment. Even though, because it's, as a patient, it's hard for you to distinguish between minor tooth movement and full treatment orthodontics. And as far as I'm concerned, full treatment orthodontics should always include, of course, looking at it holistically, all of the other structures that are affected and impacted by how your teeth meet. Not just how they look from the front, but how they meet, how they chew, what your lower jaw position is relative to your upper jaw, how you hold your head, what your facial profile looks like, and how big your airway is, and how your jaw joints feel and function. If you're able to open wide or not open wide, is that a reason to wait on orthodontics and do something about your jaw joint that clicks, pops, and hurts, and you can't open very wide? Yes, that's right. That should be taken into consideration, and it is standard of care not to move teeth until the jaw joint is healthy and aligned properly and not making noise or painful. So these are things that, a lot of practitioners, especially, well, I shouldn't say especially general practitioners, because a lot of times it's the general practitioners that have looked into some other things, like the holistic practitioners that do ortho, such as myself. And a lot of times orthodontists are very happy to do just a quick cosmetic fix for a full orthodontic fee, because you think you had orthodontics. You don't know the difference between a tiny little fix of a few front teeth and full orthodontics that takes, a year and a half instead of 6 months. And the fees that people charge are sometimes a full orthodontic fee when all you're doing is having a very minor tooth movement for cosmetic reasons. And the health of the jaw joint and the size of your airway is most of the time not considered, and it should be. So in the next sections of this show, I'm going to talk more about how your airway and your jaw joints should be considered prior to doing orthodontic treatment and straightening teeth. Okay, you're listening to Dental MD. I'm Dr. Jessica Saepoff. If you have questions about today's show or any other show in the archives, any other topic, give us a call, 425-427-8899, or contact the front desk of the office by email, appointments@naturaldentist.com, to get questions answered and make appointments. Okay, I'll be right back after this break.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Alternative Talk 1150, the talk of the sound.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff. Today I'm talking about orthodontics and how and why your jaw joint and your airway need to be evaluated and taken into account before any of your teeth get moved. So if you have a perfect jaw joint and you can open wide and there's no noise and clicking and your airway has been found to be good, and that doesn't mean that you have to have a sleep study in a lab necessarily. If you have no signs or symptoms or any reason to suspect a small airway or snoring and apnea at night, then fine, go for it, move teeth. But the orthodontics, actually, I believe that it can cause your jaw joints and your airway to become vulnerable if it is not done a particular way. It is possible to pull jaws and teeth back, which constricts the airway. And if you're leaving the jaw bones where they are and just moving teeth, then that's less likely. But frequently, because your lower jaw moves easily forward and back, you can go ahead and try it. Just stick your chin out. Your entire lower jaw and the teeth in it move forward and back and side to side. That's the lower jaw, which has lots of mobility. And your upper jaw, you can't move it on purpose, but it can be pushed orthodontically and orthopedically back or forward or to the side. And it can be tilted, and the tilt can be untilted using certain types of orthopedic movement appliances, like reverse pull headgear, for instance. And it's a slow movement, but your bones of your skull and your upper jaw can be moved, and they can move. When you use certain kinds of sleep apnea appliances or CPAP, especially in children, it can, because it's a thing strapped around the face and it's putting pressure on the face in order to create a seal, it actually can retrude, it's called, retrude the maxilla, which is your upper jaw, and your lower jaw, which moves easily, but it can be pushed backwards by these things strapped to the face. And I'm not sure people who prescribe these CPAPs on children are looking closely enough at the effect on the cranium and the maxilla and mandible, which are the parts of your head that hold the teeth, the upper jaw and the lower jaw. And CPAPs in kids, it's not that common, but I just wanted to mention it because it's one of those things that can push the upper jaw back. And when you have the upper jaw too far back, either because it's just too far back due to whatever genetic or perhaps the passage through the birth canal and the compression on the skull, maybe in some people that compression doesn't rebound the way it's supposed to. Maybe some of the bones of the face stay kind of jammed after that experience and don't rebound. Maybe the head doesn't become round again like it's supposed to after that experience of birth. So sometimes that's referred to as birth trauma. I think that refers to a lot of different possible things, and this is just one area where, maybe that's related. Neck issues, shoulder issues, a lot of things can be traced back, and maybe that could be looked at as a possible cause. But in any event, even though we don't know for sure in every case why the upper jaw is too far back, what happens a lot of the times in kids is that the adenoids and tonsils, which are just lymphatic tissue that can sometimes overgrow, maybe rather than being overgrown, maybe the space where the adenoids are, which is directly behind your nose and your maxilla, so your upper teeth, if you trace all the way back into the upper part of the throat, above where you swallow, behind your nose, that's the nasopharyngeal, I don't remember the exact term. Anyway, that area is where the adenoids grow. Maybe if the maxilla was forward where it belongs, that overgrowth of adenoid tissue wouldn't obstruct the airway and cause a child to not be able to breathe well through their nose. Anything that prevents nasal breathing is a problem for children because they will open their mouth and drop the tongue down into the floor of the mouth and breathe through the mouth. And if that's allowed to continue, it's fine for a day or two if you have a cold and then the mouth closes again. Then if it's just a few days, that doesn't affect overall lifelong, issues and growth. But if it is a chronic problem of breathing through the mouth for a child, then the jaw will neither jaw will grow the way they're supposed to. It's sort of a use it or lose it deal, because if you do not use your nose and the mouth hangs open, the upper jaw does not develop the way it's supposed to. It doesn't come down and forward the way it's supposed to, but the lower jaw goes down and down and back, really, and you end up with a long face and a retruded chin. And if that is allowed to continue past a certain point, then the only possible way to reestablish proper facial proportions might be surgery, and it's a pretty intensive surgery where I call it cut and paste, and they put the jaw back at the correct angle, put the teeth together, make it so that you can breathe through your nose, all of that stuff. And it really is a shame when it comes to that, because as a child, this mouth breathing situation was not corrected. If that can get corrected, and then the teeth can come together, the mouth can close, the jaw grows down and forward the way it's supposed to, the upper jaw grows down and forward the way it's supposed to, nasal breathing occurs normally, which is important for development of the sinuses. And now, it is possible in children to do expansion orthodontics, which is really orthopedics, and the roof of the mouth is the flip side of the floor of the nose. If you can widen the nasal passages by widening the palate or roof of the mouth, sometimes that's enough to solve the nasal breathing problem and get children to close their mouths and breathe through their noses. But if that is not sufficient, then removing surgically the adenoids and sometimes also the tonsils is what's necessary to get children breathing through their nose. It is critical for children to breathe through their noses. It's helpful for everybody, but especially during growth, because if they're not breathing through their nose, it affects the way the face grows. It affects how they look for the rest of their lives. That is really important. It's not just function, it's also looks. And the long face with the mouth hanging open is not how you want your child to look as an adult. So it is, as a holistic and natural practitioner, I am all about catching these things early to try to prevent the need for any surgery. Surgery is very radical, very invasive, and anything that can be fixed or managed non-surgically, that's the preference. So just leaving these kids as they are with the expectation that it's okay, we'll just put them in surgery when their growth plates stop growing and fix it then, that's not my favorite philosophy. Even removing tonsils and adenoids, right now the current way of thinking about this in the mainstream is if a child is mouth breathing, check the tonsils and adenoids, go into surgery and remove those, and if that doesn't work, then try orthodontic expansion. To me, that's backwards, because orthodontic expansion and orthopedic positioning of the maxilla and mandible to optimize the airway and improve nose breathing is a much less invasive way to begin. And if it's really severe, of course you're going to go, I mean, if the airway is obstructed, you're going to want to do whatever it takes to get that airway open. And if that's surgery, then that's surgery. But in a case where, you know, a child has narrow jaws and cross bites and all of that, in that case, expansion orthodontics and orthopedics is necessary anyway. So you might as well get started with that, and then if that improves the airway, then you can cancel the surgery. But to do surgery first and then say, well, you know, in 50% of cases, removing tonsils and adenoids only works for a little while, and then they go back to nose breathing, then try, you know, then they say, okay, now it's okay to try expansion of the arches. Why wait on that when it's obvious that a child needs their jaws expanded anyway because they're developing narrow dental arches? Why not jump in and start with that as soon as the child is able to tolerate impressions and a dental procedure? Anyway, that's my philosophy on that. Less invasive is always better, but invasive, if necessary, if non-invasive methods have not worked or are not working fast enough, then sure, do a surgical, you know, option. That's a more natural medicine philosophy is to start with less invasive techniques before moving to more invasive techniques. All right, and of course, less toxic before more toxic materials and techniques. Okay, we're heading into a break. You're listening to the Dental MD radio show. I am the host, Dr. Jessica Saepoff. And if you have any questions about today's topic or any other topics in the archives on KKNW AM 1150, then give my office a call, 425-427-8899, or you can reach the front desk by email to ask your questions or make appointments, and that is appointments@naturaldentist.com. Okay, thank you very much. I'll be right back after this break.
I'm Dr. Anthony Lazarowitz, and this is Climate Connections. Last fall, Australian Mina Gooley set out to run 100 marathons in 100 days. She wanted to make headlines, but not for herself. She was trying to get the word out about water scarcity, an issue growing worse with climate change.
Experts already predict that by 2030, we will have a 40% greater demand for water than the supply of water available.
Gooley says when she started learning about this crisis,
I could not believe that everybody on the planet wasn't talking about water, and I decided I wanted to do something about it.
During her recent campaign, she ran, not in organized races, but on her own, in places such as China, South Africa, and Jordan that face water shortages. She tweeted and blogged about the people she met and the stories they shared. A stress fracture forced Gooley to stop running after 62 marathons, but her followers took over, running in their home countries, logging miles on social media, and posting about water.
The way in which this global community has come out and said, we'll put our hands up, we care about water too, and let us be part of this movement, that has just been the most incredible experience I could ever imagine.
Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Alternative Talk 1150 is your sports organization's safe bet when it comes to airing your team's games. Our players are all seasoned professionals when it comes to sports programming. Imagine your games being heard on local radio. Your team deserves the MVP treatment. Call 425-653-1150 today to learn how affordable and fun it is to broadcast your games on the radio. Call 425-653-1150 and make your next season something special. That's 425-653-1150.
Alternative Talk 1150, local talk for the body, mind, and soul.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff. Today I'm talking about orthodontics and how that relates to your size of your airway and your jaw joint. So the course that I recently went to was taught by an orthodontist, and he talked about the two main movements that are possible in orthodontics other than moving of the individual teeth. One is retraction and the other is expansion. Now, retraction is any time teeth are pulled back and kind of crunched in or space is closed by moving teeth or jaws inward. And expansion is the opposite, to expand outward, and that goes for the jaw bones and the teeth. And he says that in his career, he has stopped all retraction, zero retraction. Everything is expansion. Now, he was advocating expansion orthodontics, which, you know, in all ages, it's true. I've been doing expansion orthodontics for 20 years in children and adults. It's been proven over and over and over that not only Can the bones move after a certain age? They can still move. Nothing is locked up. The old philosophy was that after a certain age, you couldn't expand anymore. And if you wanted anything bigger or in a different position, then it had to be done surgically. That is untrue. It is possible to expand the upper and lower jaws of both children and adults. It may go a little bit more slowly in adults, but it can be done. And it does not, they used to say that you weren't really expanding the jaws, you're just pushing the teeth out of the bone sideways, and that is untrue. It's been shown in X-ray studies and all kinds of ways that can happen, but that's not what we're doing. We're expanding the actual bone with the teeth in the bone, and that's really, in my opinion, no longer in question. So expanding the upper and lower arch and also moving the upper and lower jaw forward so that the airway, which is behind the upper and the lower jaw, can be bigger. So it turns out that in his career, what he's ended up doing is basically reversing the retraction that was done for people who had conventional orthodontics, where they were either just retracted or teeth were extracted and the jaws were retracted. So a lot of people who have had extraction and retraction ortho, and that means 4 bicuspids extracted, sometimes started in early childhood, and when it started early, it's called serial extractions. They start taking out teeth in the child and committing that child to not having space for the permanent premolars, which they then enucleate before they can even erupt, and then they do the ortho. And that prevents the jaws from growing because if the teeth aren't there to stimulate the growth of the jaw, then the jaw doesn't grow as much. And the teeth may look straight, but the face is not developed the way it otherwise would have. So this affects a lot of things. Besides jaw joints and airways, it affects the facial profile and the width of the face and the how the lips sit against the teeth. If everything has been pushed back or is back because it never grew forward, then the lips, especially the upper lip, will kind of be more straight up and down or even slanted inward instead of outward. And it makes the nose look bigger. It makes the chin look bigger. It's an aesthetic problem that people deal with later using things like fillers and Botox and things that make the lips look more normal, because if the lip is not supported, then it is going to crinkle and wrinkle before its time because it's not lying properly against teeth and muscles and bones underneath. So it does affect the profile. It affects lip posture and position. Anyway, this orthodontist that taught this course, he has been busy for years undoing what other orthodontists had done for these patients. It was a very, very interesting lecture. Now, I have been for 20 years doing expansion, making room for the permanent teeth so that they can come in as close to the right position as possible because you have less relapse. If the teeth are allowed to come in crowded and then you straighten them, those teeth forever have a memory of that wrong place that they came into in the first place. So the goal is to position the upper and lower jaw correctly for a good airway and happy and healthy jaw joints that don't click or pop or hurt, and support that position during the eruption of the permanent teeth so that they come all the way in and support the bite at the right height and position, the jaw at the right position, and the upper jaw expanded for the best airway and tooth positions for function and beauty. And that's, in my opinion, that's the best way to get the maximum proper facial growth for children. Now, if you are somebody who has a child who has already started the process of serial extractions or has had extractions of premolars already and is in orthodontics, I just want to let you know that it's possible to undo and reverse it if you were to choose to. That if you don't, it doesn't mean that the jaw joints and the airways are necessarily going to be affected negatively. But it's just something to know about. It's something to know about so you can, just like I said at the beginning of the show, information is how that informs your questions so that you can ask questions and ask for things so that you get more choices in life. And now that you know about expansion versus extractions and retraction, you might ask about that. Whether, what method is being used for your child, and you might also personally be somebody who had extractions and retraction. And if you have no problems with your facial profile and how your lips sit against your teeth and your jaw doesn't pop or click, and you can open fully without any pain or problems or hindrance in the joint or muscles, and your airway is good, you sleep well, you have never been snoring or having any kind of airway resistance in your throat, or been tested for sleep apnea and found to have sleep apnea at all, mild, moderate, or severe, then you don't need to worry about it if you're happy with, the results and how that all worked out. But if any of those things are not to your liking, or you have any of those health problems that are related to jaw joint function and breathing, then you might want to look and consider these alternative ways to enlarge airways and improve jaw joint function. A lot of times, if you have a jaw joint problem like clicking and popping and you go to somebody that treats TMJ pain, you may or may not have a practitioner in front of you that will look at your airway or your tooth positions or your jaw positions. And people who look at tooth and jaw positions don't necessarily look at your jaw joint or your airway. And when you go to somebody about your airway because you've been told you snore or that you stop breathing in your sleep and then you gasp for air, or you know that you wake up a lot during the night and you feel like you can't breathe and you have dreams about drowning and suffocating and you think you might have sleep apnea, if you go to somebody that treats airway, they may not look necessarily at your jaw joints and your tooth positions and your jaw positions. It is not easy to find some practitioner who can evaluate all of those things and then help guide you to treatments that will address all of those problems, which, as it turns out, they are connected and related. So we're going to be coming up on a break here in a minute, but I wanted to point out that there are some academics in orthodontics who have put out, so-called research papers that claim to show that where your teeth are positioned in your mouth can't possibly have anything whatsoever to do with how big your airway is, which is in a totally different anatomical place. And while that sounds logical on the surface, I hope you understand that tooth position and jaw position and whether you're expanded out or retracted in can affect all of the structures of your head, including how you hold your head on your neck over your shoulders. Your overall posture is also impacted because you will change how you stand in order to breathe better. You'll change how you hold your head in order to breathe better. And that changes how your jaw is positioned and how your teeth meet. Everything is connected. All right, you are listening to Dental MD radio show. I'm Dr. Jessica Saepoff. If you have any questions about today's show or any other show in the archives, give us a call, 425-427-8899. And you can also reach my front office by email to ask questions or make appointments. And that email is appointments@naturaldentist.com. All right, thanks for listening, and I'll be right back after this break.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Did you know as many as 15 million Americans have been diagnosed with COPD, chronic obstructive pulmonary disease? Sadly, COPD is the third most common cause of death in the United States. Hi, I'm Representative Cindy Rhee from Washington. As many as 12 million adults may have COPD and not know it. COPD could include wheezing, cough, chest tightness, and shortness of breath, and it can vary from day to day. COPD is a disease that can worsen over time, and patients may experience flare-ups. Flare-ups can increase shortness of breath and uncontrollable coughing and may lead to hospitalization or even death. While COPD is not curable, there are treatments available to help you breathe better and prevent flare-ups. If you or a loved one has COPD, please talk with your doctor to create an action plan that fits your lifestyle. For more information, please visit womeningovernment.org.
Alternative Talk 1150. Talk radio for the body, mind, and soul.
You're listening to Dental MD. I'm Dr. Jessica Saepoff. Today I'm talking about orthodontics and how it might be related to your, and is related to your jaw joints and your airway and your head posture and your overall posture as well. Now, I want to talk a little bit more about retraction versus expansion, because if you've been thinking about your teeth and your bite and your facial profile and face height and proportions, and if you are somebody that had extractions and retraction where your bicuspids were taken out, and rather than allow the teeth behind the extraction sites to just move forward or to move those forward into the spaces, if instead your front teeth were retracted back into your head to close those spaces, that can affect your profile, your facial aesthetics, but it can also impact your airway behind the maxilla and your airway behind the mandible. Because when the upper front teeth are pulled back and the lower front teeth correctly sit behind them, that if your lower jaw would be more comfortable a few millimeters forward of where it is, which in a lot of cases that's true, because if the upper front teeth are retracted and the lower jaw has to sit behind them, that's sometimes that qualifies as what we call a mandibular entrapment, which means your lower jaw is also pushed back, which it moves easily forward and back. But if it's held back and kept in that position, that inward position, in order to have your teeth meet correctly, your jaw joint is also impacted by that, because when when your chin is pulled inward, your jaw joints also have a little bit of compression behind the condyle, which is the round part of your jaw joint that sits in the fossa of your bones of your skull, your temple. And your jaw joint, if it is positioned too far back, if your condyle is too far back, that can affect how the disc inside the joint, which is supposed to act as a cushion, that affects how it moves. And if it's not moving correctly, that can sometimes appear as a clicking or popping in the joint. So your jaw joint health is affected over time if that disc cannot be in the right position and move smoothly. It affects the muscles and the ligaments around the joint, and also right behind the joint is your ear canal. So it can even affect how your ears feel. And between the jaw joint and the ears are a whole bunch of blood vessels and nerves. If those are compressed chronically, that can affect things with your body and your overall health. So if you've had teeth extracted and you feel like your lower jaw isn't perfectly comfortable, and you had popping and clicking in the past, or you do now, even if you do or do not have pain with your jaw joint, if you can't open fully, or you just, are rethinking how your orthodontics was done, where you had extractions and everything was pulled back, I want you to know that it actually is possible to at least partially undo that and reverse it. Those spaces can be reopened. The problem with doing that, and the retraction that was done, can be undone through expansion and orthopedic work. And your jaw joint can be repositioned correctly so that if your disc isn't too damaged, it can go back to its correct position and then move smoothly without popping or clicking anymore, and without pain. And your range of motion can improve as well. If you're thinking about these issues, I want you to know that reopening the spaces is possible, but it doesn't look very good to have that bicuspid space open. You're committing to having to have some kind of restorative work, such as implants to replace the teeth that were taken out, or fixed bridges, which can be done very conservatively. The teeth on either side of that space do not have to be drilled down to little stumps, even though that's how it's frequently done. People who try to talk you into getting implants anyway like to tell you that if you got a bridge instead, your perfectly good teeth on either side of the space would be drilled down to little stumps. That is not necessarily true. They do not have to be done that aggressively. It's possible to have very nice conservative bridges. Then it looks like the teeth are back where they were and function is good. But you can also do it with implants so that each tooth is an individual still. And that's a big project. It can get expensive doing all of that, ortho and TMJ therapy if you've had problems with your jaw, and airway, making sure that your airway is improved or that it's addressed through CPAP or an appliance of some kind to prop that jaw forward and keep that airway open if necessary. Surgery is also another option for bringing the jaws forward permanently and bolting them into place so that your airway is permanently bigger. That surgery is pretty major, but it does, in a lot of cases, solve that problem. It sometimes creates new problems. Obviously, all surgeries can. cause problems if there are complications, which in some percentage of cases there will be. So it commits you to restorations of those bicuspid spaces if you choose to have them reopened. But the advantage of doing this orthodontically and then getting non-surgical tooth replacements there is that your airway can be improved, your facial profile can be improved, your lip posture can be improved, your jaw joint function can be improved if it's done correctly by somebody that knows how to evaluate these things, how to watch progress on these things, and how to make sure that these other problems are being solved at the same time that your orthodontics is being done. So, yes, I have the requisite training and experience for 20 years of working with TMJ, jaw joints, and airway. I am well trained in airway management and science and treatment, medical and dental. And I've been doing orthodontics by expansion for 20 years in children and adults. So putting it all together, one of the things that I have not pushed on patients, because it is a major thing, is reopening spaces. But it can be done, and I am willing to do it for people who want to do that or for whom it is necessary in order to correct other issues. So yes, I wanted to give you a full overview of how all of these areas are connected, can be connected, and how doing treatment in one area can affect the other areas. So, yeah, especially in children, I believe these problems can be prevented. I think TMJ problems can be prevented. Mainstream says no. I believe sleep apnea and airway closure and restriction issues and mouth breathing instead of nose breathing, I think these things can be treated early and prevented from becoming worse problems later, and promote proper facial development rather than just letting the face not develop as a child continues to breathe through their mouth and have allergies. And I think these things should be seen and treated early, and they can also be treated later. So you have been listening to Dental MD. I'm Dr. Jessica Saepoff. I'm going to give you some more information about how you can reach us to ask questions and get an exam and an evaluation of all of these areas that are connected, and see whether you're a candidate for any of these treatments or preventions, or your children have issues, and we can jump in and prevent problems for them. All right, so you can call the office 425-427-8899, and you can reach us by email. When you email the front desk using appointments@naturaldentist.com, they will relay your clinical questions to clinical staff or to me, and I will give answers, and they will relay those back to you. And when you come in for your exam, we will go over all of that. We'll go over all of your options. We'll look at everything that's been done for you and to you by dentists and other practitioners in your past, and we will look forward to what kinds of things we can do to alleviate problems, prevent problems, and reverse problems. So appointments@naturaldentist.com will get you to the front desk, and you can also go to the website, naturaldentist.com, and on that website you will find drop-down menus with more information about all of these topics that I've talked about, and I'm always adding more information, and we're connecting my other blog, which is drsaepoff.com, Dental MD, on WordPress, and that's being connected in. And you can also click on the website to get to the archives of the radio show and the YouTube channel to watch the radio show right on YouTube. All right. Well, thank you very much for listening. I will be back next week with more and different topics in dentistry so that you know what your options are for treatment. Thanks for listening. This is Dental MD. I'm Dr. Jessica Saepoff.
The views expressed